Hudak. I'm one of the interventional cardiologists here at Carolina Cardiology. I'm also the director of the Chest Pain Center, the Coronary Care Unit, and the Cardiac Telemetry at Greenville Memorial Hospital, which is part of the Greenville Hospital system. You'll know that you're having a heart attack by the symptoms, and those symptoms are chest pressure, chest tightness, sometimes pain, unexplained shortness of breath, sudden sweating, nausea, vomiting. Really, you can have discomfort in the chest anywhere from your chin down to your belly button. There's a lot in the popular press about the fact that the symptoms that women have may be different from the symptoms that men have, and that is definitely true. The typical symptoms that a man will have, and it doesn't mean that a woman can't have them, but are the retrosternal, behind the breastbone, someone sitting on my chest, radiating down the left arm. Women can have that as well, but sometimes the symptoms are not quite as clear as that. Sometimes it's more shortness of breath or a smothering sensation. You can get symptoms down the right arm, the left arm, both arms, the shoulders. Really any unexplained symptoms from the chin down to the belly button warrant consideration for the possibility, at least, of a heart attack. So I want to be very clear about this and emphasize this because it's very important. If you have these symptoms, the thing to do is to immediately call 911 and get emergency medical service coming your way. Do not get in the car. Do not have somebody else drive you to the hospital. Do not drive to the hospital. The reason for that is, again, the diagnosis and the therapy can be started at the bedside by EMS, and that's an important part of activating that STEMI network, that whole program, so that before you even arrive at the hospital, there are 40 people that know that you're coming with a heart attack, and they're going to be ready when you arrive. The type of heart attack that's most concerning is what we call a STEMI, which is an ST elevation myocardial infarction. Fancy word for a heart attack, but it's a particular type of heart attack. It's the type of heart attack that truly is a medical emergency. One of the arteries that supplies the heart muscle is completely 100% blocked. There's no flow. Damage is occurring as we speak, and that's an emergency because we need to open up that artery immediately. The only way to know whether you're having that kind of heart attack is to get an EKG, which can be done by emergency medical technicians. If you're having symptoms of a heart attack, when you call 911, EMS will arrive and have them ask them to take you to Greenville Memorial Hospital, because we have the only accredited chest pain center in Greenville County, and we have the largest STEMI network in the upstate. When you call 911 with symptoms that you think are a heart attack, and you've asked the EMS to take you to Greenville Memorial Hospital, you should be very comfortable with the fact that you're coming to a place where there are 40 people on alert 24/7, 365 days a year. They're on alert to meet you at the door with your problem, with your potential heart attack. If this is a ST elevation heart attack, then most likely you will proceed right to the cardiac cath lab, where we will mechanically open up that artery in a number of ways, most often by using a stent to prop open the artery, restore flow, relieve your symptoms, and prevent further damage to the heart muscle. After the procedure is finished, what one should expect is generally being in the hospital for about 72 hours. We do monitor people in the coronary care unit for at least the first 24 hours or so. An important part of being in the hospital is having an understanding of what's happened, in addition to understanding what the plan is going to be from then on. The STEMI program at Greenville Memorial Hospital, I think, is very highly developed. It's really more than a program, it's a network. And by that we mean that there are several other hospitals, not only within our hospital system, but also including some of the neighboring counties, that refer patients our way if this kind of heart attack is occurring. And it's very well organized. We interact very, very well with the emergency medical services, not only in Greenville County, but also in the surrounding 5-county area. The Chest Pain Center at Greenville Memorial Hospital is the only accredited chest pain center in Greenville County. We've gone through the 3rd cycle of accreditation, and each cycle gets more demanding. And we are, in terms of our evaluation for the last accreditation, which occurred within the last year, we're probably within the top 2 or 3% of chest pain centers in the nation.